Hello, good morning everyone. Today I will presenting my research proposal titled Awareness of the Garden Hour of Stroke among public in Sarawak. This study is part of my bachelor and it aims to explore the critical gap in stroke awareness in Sarawak. So let's get started. Stroke is a neurological emergency that can cause significant long-term disability, especially in the case of ischemic stroke, which are the most common type. The golden hour is the crucial period after the onset of stroke symptoms, there when the treatments such as clot busting drug are most effective. If treatment is delayed beyond this window, patients face a higher chances of permanent disability. In Sarawak, this window is often missed due to delayed recognition of stroke symptoms, particularly in the rural and the indigenous communities. In these areas, people tend to seek traditional healer first, which delays the crucial early medical intervention. And this issue highlights the need for more awareness about the importance of early stroke intervention in the Sarawak, particularly among the rural and the indigenous populations. Stroke is the second leading cause of death worldwide and the third in Malaysia. In Sarawak, the stroke rate is significantly higher than the national average, particularly in rural areas. Sarawak is the largest and the most geographically fragmented state in Malaysia, and about 43% of its population live in remote area, making time medical intervention a major challenge. The golden hour refers to the critical 4 to 5 hours window after a stroke when intervention can greatly reduce disability and mortality. However, in Sarawak, many patients miss this window due to delayed hospital arrival, often caused by the geographical installation of rural area and cultural belief. In fact, many people in Sarawak, particularly in rural communities, they are mistakenly attribute stroke symptoms to supernatural causes, which delay seeking medical attentions. The lack of awareness of stroke symptoms and the garden owl stroke is a major problem, particularly in rural and indigenous communities. Studies have shown that many people in this area do not know the symptom of stroke or the critical window for intervention. This lack of awareness results in delay in seeking medical help, which negatively impacts patient outcomes. Additionally, cultural beliefs such as Angin Ahmad, wind stroke, or Sakit Umai, which is spirit affliction, often prevent people from seeking timely medical care, as they first turn to traditional healers. This delay in seeking medical help exacerbates the severity of stroke and contributes to higher disability rates and mortality in these communities. So the primary aim of this research is to assess the level of awareness of the garden hour among the public in Sarawak and to develop culturally adapt intervention to improve this awareness. The specific objective to measure the awareness of stroke symptom and the garden hour among different demographic groups in Sarawak, including urban and rural populations, to identify the demographic barriers to garden hour awareness, such as geographic location, ethnicity, and education level, to analyze the healthcare seeking behavior of the population in relation to garden hour awareness, and to explore the cultural barriers through the focus group discussion and investigate how belief and the practice influence the healthcare seeking behavior. So let's now move on to the literature review first. I will discuss the garden hour therapeutic imperative. There is strong clinical evidence supporting the idea that early intervention within the garden hour can significantly reduce long-term disability and death. As per Powers Out from 2019, reperfusion treatments like TPA can reduce disability by 30 to 50% if administered within 4 to 5 hours of symptom onset. Every minute of delay in treatment results in the loss of 1.9 million neurons, which underscore the critical nature of timely intervention. The findings are supported by global guidelines, including this outlined in the guideline for the early management of acute ischemic stroke, which is Powers et al. 2019, which stressed that every minute counts in improving outcome for stroke patients. Now let's move to the social cultural determinants of health seeking behavior. In Sarawak, cultural belief about stroke often influence how people respond to symptoms. A study by Wong, Ismail, and Ten, 2021, found that 58% of people in rural Sarawak first seek treatment from traditional healers, rather than going directly to the hospital. This delay is due to the widespread belief in angin ahma, which is wind stroke, and other supernatural causes of stroke symptoms. Such cultural perceptions create barriers to seeking timely medical help, which leads to worsened health outcomes. This is why it's essential to address this cultural belief when creating public health campaigns and intervention strategies to raise awareness about the garden hours. Next, I will focus on the epidemiological deficits in Sarawak. Research by So, Abidin and Chen 2003 has shown that there is significant lack of stroke awareness in rural areas of Sarawak. In particular, 72% of the Iban community cannot identify two or more symptoms of stroke, and 85% are unaware of the garden hour. This lack of awareness is a significant barrier to timely stroke treatment. People in rural areas are often unaware that recognizing stroke symptoms and acting quickly can greatly improve survival and recovery. This is critical issues as the delay in seeking medical care in rural areas, Sarawak, is substantial, which means that many patients miss the opportunity for effective treatments. Finally, I will discuss the support for culturally adapt interventions. Research by Theo and Lee and Ibrahim 2024 demonstrates the effectiveness of mobile health campaigns in increasing stroke awareness among indigenous communities in Borneo. The study shows 72% increase in symptom recognition among those exposed to culturally adapted health campaigns. This finding highlight the importance of tailoring health intervention to the cultural context of the target population. In Sarawak, using culturally appropriate language, image, and local belief of in stroke education can significantly improve awareness of stroke symptoms and the garden hour, ultimately leading in a better health outcomes. Now let's move on to research methodology. This study will use a mixed method sequential explanatory design. The first phase will involve the quantitative data collection, where a survey will be conducted to measure the awareness of stroke symptom and the garden hour among a sample of 550 adults across urban and rural areas in Sarawak. In the second phase, qualitative data collection will take place through focus group discussions. This discussion will explore cultural and demographic barriers to awareness and healthcare seeking behavior. The combination of this method will allow for comprehensive understanding of both awareness levels and the underlying factors that contribute to the lack of awareness and delays in stroke treatment. This is expected to make several important contributions. Empirical novelty, the study will provide new data on garden hour awareness across Sarawak, filling a significant gap in existing literature. Culturally updated interventions, the research will help develop culturally appropriate educational toolkits and intervention strategies tailored to the diverse populations in Sarawak. Policy recommendation based on findings. This study will provide evidence to inform public health policies, including strategies for resource allocation to high-risk district and collaboration with traditional healers. and global transferability, the research methodology that can be applied to other regions with similar cultural and healthcare challenges contribute to global efforts to reduce the burden of stroke and other non-communicable diseases. Finally, here are the key differences that used in the research. The study provides the foundation for the research design, methodology, and theoretical framework. They include important work by Powers et al. 2019 on stroke treatment, as well as studies specific to Sarawak by So et al. 2023 and Wong et al. On stroke awareness and cultural perceptions. This gunshot outlines the key milestone for the project. The research will begin with preliminary activities such as proposal submission and research title selection in June 2025, followed by questionnaire formulation and a pilot study in July. The data collection phase will take place in August with data analysis, discussion, and final report writing scheduled for the later months of 2025 and early 2026. This timeline ensure that the study is complete by May 2026. Thank you.